So at the Edinburgh Practice, what we do is to provide a clinical evaluation following the sign guidelines and NICE guidelines to support families understand, I suppose, their children's presentation to see whether or not that would meet the criteria for autism. The assessment we provide is a multidisciplinary assessment. It involves clinical psychology and speech and language therapy and some of our other colleagues from other professions to ensure that we're providing a multidisciplinary assessment. First stage of the assessment process involves an initial appointment with one of our professionals. The second appointment may be the ADOS, which is a 1 hour to 1.5 hour appointment with your child. And that is where they come in and they meet with one of our clinicians and a colleague. And the appointment will be to look at their social communication, their social interaction, flexibility of thought. And it's a sort of informal assessment. They do some activities and answer some questions. And for younger children, it's primarily a play-based assessment. After that, the clinicians will meet to discuss the outcome of that assessment, and that will contribute to the overall process and assessment. Another part of the assessment is a parent interview, which is a detailed developmental interview informed by something called the Autism Diagnostic Interview and supplemented by a questionnaire. This is an opportunity for you to discuss how your child has presented over the years, as this forms an important part of the assessment to ensure that there has been a developmental trajectory which we associate with autism. There will be questionnaires sent to school which will ask for information about how your child presents at school in terms of their social communication, their social interaction, their interests and behaviours, and also focus on their ability to manage routine and change within the school day. All of the information will be collated and discussed within the team, and we will measure that against the diagnostic criteria for autism. And the team will come to a conclusion as to whether or not we feel your child's presentation is consistent with the diagnostic criteria. And then we will meet with yourselves again to provide feedback and discuss recommendations in terms of supports and strategies which we feel would be helpful. And then we will provide a very detailed report which will cover all parts of the assessment and make subsequent recommendations. In addition to this, we will provide information to school which will summarise the assessment and provide recommendations that we feel would support your child moving forward. We accept referrals from parents and self-referrals. Should you have an inquiry about your child or young person, you can contact our service and look at the website. We could also meet for an individual appointment which would support you to inform whether this was going to be an appropriate way forward for your family. So when the report is completed, we will send a copy to your child's GP so that it's in their medical records. We will provide information for you to give to school, which will provide those recommendations. In terms of ages for referrals, we would see children from age 3 to 18. When children are younger, we would encourage that they seek involvement from child health services within their local health board, but we would liaise with services to consider support around much younger children and support assessments.